Well, official thank you and welcome to everyone. As you just heard, we are recording this event, so we will be able to share this afterwards and also have you share it out with others. Welcome to our virtual program visit to Peru. Good morning to some of you, good afternoon to some of you, I think good evening to some of you. It's really great to be here today with you. My name is Rachel Steinberg, for those who don't know me, and I'm the Managing Director for Global Cause Partnerships here at Unicef USA. I've had the opportunity to work with our Zonta partnership for quite some time. I also happen to be a member of the Zonta Club of Brooklyn, so happy to be amongst your ranks as well in many different ways. I think it's really special for us all to be here today for this opportunity to connect with each other first and foremost, but most importantly also to connect with Unicef Peru and to the adolescent girls that our partnership together are impacting. So let me start with some thank yous. First of all, a heartfelt thank you to all of you and to Zonta International. I want to thank you for your dedication over many, many years to women and girls, and especially want to thank you for your dedication to this partnership in what has been a really trying time. I want to thank you for your generosity. I want to thank you for almost 50 years of partnership together with UNICEF. UNICEF is actually turning 75 this year, so when we place it in that context, it's absolutely inspiring to recognize that you have been a partner in this journey with us to create sustainable change for children for such a significant part of our history. You are one of, if not our longest standing partner, and I want to recognize that and thank you for that. I also especially want to thank and welcome Zonta International President Sharon Langenbeck, who I know you all know quite well, so I don't need to introduce in great detail, but I really want to thank her for her leadership in leading to this partnership in Peru specifically. And I also want to thank, of course, the Zonta International team for all the hard work that they put into organizing this event together, and to Sharon for her vision for this program visit. I also want to make sure that I acknowledge the presence of previous international presidents. I know we have past international presidents, Suzanne von Basswitz, on this call. I believe we will also shortly be joined by another past international president, Valsera, if she is able to get on, although it is, I believe, 3 a.m. her time, Australia. So hopefully she may have decided to sleep instead. But thank you all also for your history of leadership and partnership with us. And lastly, let me thank the UNICEF USA team, Kelly Persida and Monsi Mehta, who you all know quite well as our current manager for the partnership. And Monsi will be facilitating our Q&A later, so you'll get the chance to see her soon. And lastly, but certainly not least, thank you to UNICEF Peru. Thank you for making the time to be with us today to share more about the work that you're undertaking with Zonta support. And we're so eager to learn today about the impact of our programs together and how you're continuing forward despite the many challenges you're facing, including COVID-19, and we really value your time with us. Although we would normally get the chance to gather in person at least once a biennium for a visit, for a chance to see our programs in action together, being virtual, I think, has its benefits. I don't know if we would get to see all of you in person in the field. And so I'm really grateful that we have the opportunity to open the tent more widely today to Zonta members and leaders around the world and to see you all, even if it's through a screen. As some of you know and have been with me before, I've had the good fortune of going to visit our programs in action in Madagascar twice. And I will say that these have been really significant experiences for me, and hopefully for those of you who have been in the field with me. And on one of these visits, we got the chance to visit a peer-led life skills program that brought together adolescents to discuss the topics that were affecting them, and particularly the topics that were preventing them from thriving. But the great thing about these peer-led sessions is what they also had the goal of facilitating opportunities for them to do specific projects in their communities to take action against the issues that were preventing them from thriving. And it was such a meaningful and incredible experience to sit side by side with Zonchins in a circle of adolescent girls and adolescent boys talking courageously about the issues that were impacting them in their communities and talking about what they were doing to address those issues. And to hear testimonials of teenage girls who felt empowered to reject unwanted early marriages, which was quite a challenge for them individually and within their families, thanks to this program, was so meaningful. And it's this type of impact that we're making together in Peru now too, from that individual girl to the community, and then ultimately together creating a cascade of transformative and sustainable change around the world. And it's this type of impact that we're going to learn about today and that we're going to celebrate today, and that will hopefully be driven to do more about today. So thank you, welcome. I'm now going to begin our journey into the Amazonian regions of Peru. And so we'll start with a video which highlights some of the accomplishments of the program so far. And then afterwards, we'll have the chance to hear from Unicef Peru representative Ana de Mendoza, who will provide us with that further context on the program and the challenges faced in Peru due to COVID-19 and how critical Zonta's partnership has been.
Tengo a mirar a ese estudiante en diferentes dimensiones. Un ser que piensa, que siente, que necesita el apoyo de sus padres de familia, de la comunidad, de cómo relacionarse con sus compañeros. Ver también a ese ser que tiene imaginación, tiene una religión y sobre todo que tiene que estar bien, tener una salud física y mentalmente bien para lograr lo que nosotros añoramos los maestros, sus aprendizajes, que desarrollen sus competencias.
Creo que los adolescentes para mí son como una esponja que absorben, y para ellos esa experiencia de venir al servicio, lo que es en el servicio diferenciado, les ha ayudado bastante porque aparte tratamos temas, conocen muchas cosas referente a lo que es salud sexual y reproductiva, lo que es planificación familiar, lo que es violencia, hablamos muchos temas, lo que es salud bucal, y a ellos les ayuda bastante en eso, ¿no? Se van, como se dice, aprendiendo.
Esto ha ido siéndose cada vez más constante, razón por la cual muchos de nosotros hicimos el pedido de que crearan o se generara un espacio específicamente para adolescentes, donde que nosotros podamos visitar, preguntar nuestras inquietudes, conversar, dialogar con el personal de salud, y que también el personal de salud sea empático con nosotros, se ponga en un espacio con nosotros específicamente para conversar, para dialogar. Razón por la cual es que ahora sí hay un espacio donde que nosotros los adolescentes podamos visitar y conversar de todas nuestras ideas, inquietudes, no sé, preguntas, y esto pues ayuda mucho a nosotros los adolescentes.
Juntos podemos seguir contribuyendo a que haya mejores capacidades de respuesta en el tema de salud, que sean de calidad, que sean diferenciados y que sea integral, poniendo énfasis en la atención en la salud mental, ¿no? Y en la prevención de la violencia, especialmente violencia de género. Juntos podemos llegar a más adolescentes, ¿no? Fundación Sonta para la Mujer, gracias por todo el apoyo, porque permite que más niños, especialmente las niñas, puedan tener un futuro mejor.
Thank you. I'll turn it now to our representative in Unicef Peru, Ana de Mendoza.
Hello, good morning, good evening, good night. Thank you very much for being here. I wish you could be here with me in Peru. So I hope next time you can come to visit us. And well, I know that the video has given you a panoramic of how is the situation and how is the actions that we are doing with the great support of Sonta. But I wanted to give you, in a nutshell, an overview on how is the situation of the children in the Amazon, and also how has been the overall response to COVID-19 with your support. So as you may know, Peru has achieved significant advances as a developing country. It's a high middle-income country, but there are still great disparities, specifically in the rural and remote areas, where the access to basic service is limited. And at the same time, these services sometimes are not very, they don't have the quality that they need, or they are not culturally adapted. So evidence in Peru has shown that belonging to a rural area or to an indigenous community, or being a woman are the most obvious conditions for vulnerability in the Peruvian Amazon. As an example, while 70% of Peruvian adolescents finish their secondary school timely, when we go to an Amazon region, this number goes down to 60%. And when we are seeing the most excluded population, those who are living in extreme poverty, this drops up to 40%. So only 40% of extreme poverty children, they are able to finish secondary education. There are some factors that prevent also the access to education and the termination of the scholarity. And especially they are very relevant for girls. No? For indigenous girls, we have some factors as early pregnancy, physical and sexual violence, and gender-based stereotypes which prevent girls to remain in school. And this is a big loss, because Peru has made a lot of efforts to try to incorporate all children, boys and girls, into the school, but then we see that women, especially in rural areas and Amazonian communities, face specific challenges to continue into the school. No? So in Ucayali and Huancavelica, we have higher rates of unwanted teenage pregnancy. The national average is around 80%, but in Ucayali we go up to 14%, and in Huancavelica 11%. So that means that the problem of adolescent pregnancy is really high in these figures. No? If we look into indigenous population, the situation is even worse. As you may know, COVID has hit very hard Peru. In the first case we had in March 2020, and up to now we had more than 2 million confirmed cases of COVID and 200,000 deaths, which is one of the most affected in the country. The government took measures with mandatory lockdowns over the country, social distancing, movement restrictions, school closures, and closure of commercial activities. Unfortunately, schools remain closed. Most of them are closed. We have been advocating very, very hard to open schools in the rural area, and we have been quite successful on that, but we are still missing more than 7 million of children who are not entering in the school, re-entering. No? With your support, we have to rearrange our approach to the program because of COVID, but we were very successful to sustain primary healthcare services that were suspending during the pandemic. So we have been strengthening these health services and health personnel again to reopen the services for girls and boys in these regions. No? The restrictions, as you may know, has imposed also a lot of challenges to identify girls and boys suffering from violence. So we have been also trying to improve the systems and the online systems of the state to detect and prevent this violence. So, in terms of education, the state rolled out an online program, which is Aprendo en Casa. But as you may imagine, in many remote areas, the lack of connectivity and even the lack of electricity prevent boys and girls to be part of this program, because many of them, they don't have electricity. No? So both Ucayali and Huancavelica, they have been affected by the pandemic due to poor connectivity, weak health systems, and lack of medicinal oxygen and isolation, affecting particularly to rural and indigenous population. No? So the main challenges that we are facing now is limited vaccine availability, and especially in the indigenous population, we are doing extra efforts to ensure that they are protected against COVID. Unicef also is providing logistical support, and we are working with the state to reinforce the cold chain equipment to ensure that it goes to remote areas. No? In this context, very complex context, the support from SONTA has been extraordinary to guarantee the rights of children and adolescents. Adolescents have been neglected in this pandemic. They have been put apart as non a priority, and we have been supporting to address health needs, but also prevent unwanted pregnancy and provide protection from violence. The project that we have been implementing with your strong support will continue to develop the collaboration between health, education, and special protection services at the local level to ensure they have an integrated approach. SONTA and UNICEF collaboration continues to provide a healthy and protective environment in these complex situations, especially for indigenous and rural adolescents. And I would like to give you a brief also from the adolescents' point of view, because we wanted to have them here, but it was very difficult. So we asked them to participate in a short video, and I would like to give my strongest appreciation for this partnership that we have together, and to show what do they think about the program. Thank you very much.
Aquí en la comunidad sí hay casos de violencia familiar, violencia sexual, violencia física hacia los niños y adolescentes. Y tenemos 2 casos de violencia en mi colegio, en la institución, que 2 chicas están embarazadas. Para mí ha incrementado la violencia en casos de pandemia, y porque las 2 chicas han embarazado durante la pandemia. Y las 2 chicas que están embarazadas están siguiendo a estudiar y vienen al colegio, y a veces yo voy a sus casas a visitarles, a conversar con ellas, y también hemos creado un grupo de WhatsApp para que nosotros podemos ayudarles a darles este ánimo, que no dejen de estudiar, que sigan cumpliendo sus metas, ¿no?
Para nosotros la escuela sí es un aliado importante, porque a través de la escuela nosotros inculcamos a los chicos los conocimientos, cuáles son sus deberes, sus derechos. Entonces la escuela desde ese espacio brinda a los estudiantes el asesoramiento y protección. Acá en la institución nosotros hemos aprendido, cuando
hay un caso de violencia, dónde puedo ir a pedir ayuda. Y hemos aprendido en las postas médicas, en las de MUNAS, para que nosotros no queremos ver los casos de violencias en las comunidades.
Thank you so much for that great overview, Anna, and for producing this great video. It's really great to hear the voices directly from the youth out in the field. So thank you. I think I will hand it over now to President Sharon, who's going to be able to facilitate a nice fire chat with Anna directly.
Thank you, Rachel. And yes, both of the videos and the introduction by Anna gave us a great introduction, but I know that our Zonta members have additional questions, and I think I would try to summarize some of these questions before we go to the Q&A. So the first question is, how has Zonta's impact specifically contributed to this program during the past year and 3 months?
Hi, Sharon. Thank you for the question. Well, FONTA program has allowed us to continue working in Ucayali and Huancavelica in this extreme condition that we were talking, remotely from Lima, but with a foot in the ground in Ucayali and Huancavelica. And we have been ensuring that we can provide an integrated approach that focus on health, education, and child protection services and adolescents, girls empowerment. No. So as you may know, we work at the national level, but we also work at the territories, and this allows us to showcase to national government how to scale up an initiative. So the SONTA program is being so successful that national authorities, they want to learn from that and put this initiative into their national policies, which is the final aim of Unicef.
So next question. Can you talk more about the psychosocial mental health support you've incorporated into the program due to the uncertain situation of COVID-19?
Well, mental health has been affected by COVID, as you may know, in all countries, and it was quite invisible for the adolescents group. No, so what we did, we set up first a telephone hotline to provide mental health support to adolescents in need and their families, and this line was piloted as a program for 5 months. From December to April 2021, and we received almost 1,000 calls, and we were currently working with the Ministry of Health to set up a similar service and to have a service national hotline, no? Because this was a pilot, but it was very interesting to have this pilot prior to advocate with the ministry to go national. No. At the same time, we have been working with the Ministry of Health. We launched a mental health study on adolescents, and it was an online study, and it gives a very, very interesting evidence. No, it shows that 3 out of 10 children and adolescents, they have mental health issues, from demotivation, depression, anxiety, problems for sleeping. But when you go to adolescents who have not been able to connect to the distance school, these figures goes up to 7 out of 10. So 7 out of 10 children and adolescents who have not been able to be engaged with their school in the online environment, they suffer from mental health. So this is a big topic, and we are trying to advocate through your support also with national authorities to take this very seriously.
So have you seen the violence against women and girls increase during the pandemic?
Well, the violence has been risen in all countries, and it is very difficult to have a specific data, but there is evidence that the lockdown promotes potential aggressors to being exercising violence against potential victims with no with difficulties in searching for help. No, I mean the state, and we have support that to implement online and virtual support, but it's never the same. And if you are living with your aggressor, it's very difficult that you will seek for help. This is something that we have been advocating with the government, because we need to understand the dynamics. And as you know, Peru has a very high rates of gender-based violence, and we are sure that during the pandemic, this violence has risen for sure.
So have more teachers stepped forward wanting to be trained and build their knowledge on health and how to prevent gender-based violence?
Yeah, I think one of the things that it was very inspiring for me is that when talking with teachers, they were not so much worried about the loss of physical lessons, but they were very much concerned about how to give emotional support to students, no? Because they knew that students have enormous difficulties during the pandemic, no? So mental care has been a priority also for the teacher, which is a great news, no? They have this integrated approach, and they think that if children or adolescents, they don't have a good mental health, it's very difficult that they will learn anything. And the same applies to violence. So they are much aware. We have been with SONTA support, we have been training them on how to detect mental health issues and also prevent violence, and they are very aware of that. So for me, it was very inspiring to see that they were very much worried about this and not so much worried about the learning outcomes, no, right now. So I can elaborate a little bit more, but we have a training which it's called Unicef Positive Discipline for teachers. And this program has strengthened the development of socio-emotional skills, no? Such as resilience to cope with the situation, and also how to approach children and adolescents and how to refer them to the services that they need. No? So principals of the schools, they have focused we have been focusing on Huancavelica and Ucayali, and they are committed to implement this SONTA UNICEF model to prevent school violence. No? When you saw the video, many of them, they were talking and they were very aware that violence happens in everywhere, and the school has a key role to prevent and also to address the cases. No?
So one final question before we turn it to our audience Q&A. How has it been working with the Ministry of Health and local governments to implement this program?
Well, UNICEF, we always work at the national level and the local level. The aim we have is to try to incorporate our knowledge and our innovative approaches into national policies and systems. So we are in the ground, and we are very respected and very well known by the authorities. So they will seek us for advice, for instance, when they have to prepare a regulation on how to attend adolescents' health, they will seek for technical assistance. No, what we are trying to do is reinforce and strengthen local capacities, because we are very aware that sustainability is one of the key parts of the program. So after SONTA and UNICEF leaves these populations, we want to ensure that local authorities, teachers, health workers, social workers are really prepared to continue this with this integrated approach. And not only this, we want to help Ministry of Health to have a wider approach to adolescent health and a more integrative approach, taking into account gender-specific focus and also prevention of violence, which is something that the Ministry of Health has to be involved also.
Great. Thank you so much, Sharon and Anna, for sharing further insight via your fireside chat, specifically regarding the programming and the impact on adolescent girls via Zonta's support. It's always really great to hear further details. For those of you that don't know me, my name is Mansi Mehta, and I'm the Deputy Director of Global Cause Partnerships at Unicef USA. My apologies if you can hear background noise. They decided to do drilling right above my apartment today. So again, apologies for that, but we'll try to hopefully keep that in the background as much as possible. So from here, I just want to turn it over to the rest of you. We'd love to have audience Q&A. So feel free to either directly input your question into the chat that you see on the screen, or you can raise your hand and I'm happy to call on you directly, whichever you're comfortable with.
So don't be shy. I want to talk with you and I want to have your points of view. And I want you to have to be here.
Okay, I see our very first question. Anna, this is a question from Sally Bean. I'm sorry, I'll start with Barbie first and then Sally will go over to you. The first question is from Barbie. How many girls are helped in this program? And the second question from Sally is, please repeat the stats on pre and post COVID regarding pregnancy.
Okay, so I will go with the statistics first, which is, I mean, we still don't have the concrete number of post-COVID pandemic because we are still here in the pandemic, we're still with lockdowns and school closed, but we are sure, and the other UN agencies and the health services are telling us that the number of pregnancy is getting higher. No? I was telling you that the national data, it's around 8%, and in Huancavelica we have 14%, and in Ucayali we have 14%, and in Huancavelica 12%. In some other areas where we are working also, such as Loreto, which is the biggest region at the Amazon zone, this number goes up to 30%. So there is a wide gap between the urban and the rural, and also between the indigenous population and non-indigenous population regarding pregnancy. And we are pretty sure that this is going to be higher when the official figures came out. And in terms of how many girls are we attending, so more than 8,000 adolescents have received services in this year, 2021, in Ucayali and Huancavelica, and 15 of them are girls, are child girls in health services. So it might not seem a big figure, but in the context of pandemic and lockdown, for us is a great number to reach 8,000 adolescents.
Great, thanks, Anna. The next question is a follow-up from something you noted earlier during your remarks. You had said that, you know, the goal is that when Zonta leaves or when Unicef Peru leaves, you hope that the adolescents are equipped to continue their own sort of services and their own programming. So can you give us a little bit more context to that? Are there any follow-up programs that Unicef Peru is doing? Is there an annual audit, inspection, monitoring, evaluation? Any specifics on that would be great.
Thank you, Mansi, and it's a great question. Well, we have been in the territories for more than 10 years, and we are going to still be on the territories in the next program of cooperation. But when we start an initiative, like the one that we started with you, we want to ensure that we are not working alone. So we are strengthening local capacities and national capacities to really give this innovation that we are doing, this approach, integrative approach, putting together health services, education services, and child protection services to work together. And we want to ensure that this is going to be, that this will last after the project. No? So how do we do that? So we have advocacy at the highest levels with the governors at the regional level and with the ministries of health, education, and the ministry who attends child protection issues to ensure that the laws and regulations are starting to move to have a more integrated approach. We have data on investment in children at the regional level and the local level, so we can track how is the effort, if the effort is being continued or not. And of course, we have audits and we have evaluations. We have just finished an evaluation of the whole program of cooperation, 5 years of cooperation, and we went to the territories to see the results, but also the sustainability of the results, because the results to be effective, they have to be sustainable. So yes, we keep a track on what we are doing, and we try to build on what we have achieved. No? So we are going to still working with adolescent girls in Ucayali, Huancavelica, and Loreto, and we are going to improve the initiative that we have, but we want to ensure that the floor that we're building, it's a solid floor, and we can build on that. No?
Great, thank you, Ana. This next question is specific to mental health. One of the issues that you had mentioned is that mental health has been detected by the teachers themselves. Can you elaborate, if possible, on what exactly is provided to the teachers in terms of training, for example?
Well, as you may know, the teachers, they are not experts, they are not mental health experts, but they are the ones who have a daily contact with their children and adolescents. So we thought it was very helpful for them to have not only pedagogical training, but also socio-emotional training and how to detect situations that could require specific interventions. So what they do is when they have the individual chats with the adolescents, they have been trained to promote active listening, to promote empathy, and also to give them confidence so they can go to the proper services to be attended. Sometimes it's very well known that adolescents will not use health services unless they have the confidence that they are going to be listened and they are going to be treated with respect and confidentiality. And in many times we have seen that the teachers are the key person, so that adolescents go beyond their family to ask for support. So it's very important that teachers are well prepared to hear the stories and to refer to the specific services, so we don't lose the confidence. In the case, for instance, of adolescent girls who could be more shy to speak of specific issues, we have trained also female teachers to have a good understanding of what are the services providing in the locality, and who are the references that the girls could go in case they have anything related with pregnancy or something related with emotional issues also. No? So I think it's very important to have these socio-emotional training skills, but also with a gender focus, no? Because we know that in worldwide, but also in every culture, the difference of the things are expected by girls and boys are quite different, and we have to be prepared also to give the response accordingly. No? First goal for us is to build trust and confidence, so they are an adult of reference for these adolescents, and that will open the door to go to other services more specialized.
Thank you. This next question focuses on gaps in programming. Ana, can you elaborate a bit more on what you are seeing are continued gaps in programming?
Well, I mean, what we have done and what we are doing is it's amazing. I think I mean, we are changing lives of many adolescents, girls. We are changing actually their lives. And if you talk to them, they will tell you that their life has changed. But of course, we would like to reach more people. We are in a tiny part of the region in Ucayali and in Huancavelica. And as I was mentioned, we want to scale up and we want to have this most demonstrative experience to also be adapted to other cultural realities. No? So we would love to scale up the program. We would love to bring the program to Loreto, which is a very big region also. And I mean, we are prepared to scale up, but we are very happy with the results we have achieved so far.
That's great. I noticed you mentioned Loreto, and one of the questions here is also related to the two regions, Ucayali and Huancavelica. So given the differences in the regions, have you noticed a difference in response from adolescents at all between those two regions?
Well, we are very proud to see that adolescents themselves, they are changing. I arrived here almost 3 years ago. My first visit was to Huancavelica, and you couldn't barely hear them because they were very shy and they have lack of confidence. And after 3 years of program, I mean, they are different people. They are participating in networks at national level. They are able to speak out. I mean, we had a wonderful meeting with the regional governor, which is like the state governor, and they were there. And they were asking for services for them, and they were asking for to cover their needs and more investment in adolescents. And they got a radio from the governor, so they could start to make their programs on their own. So this is why I think that their life. I mean, we are changing lives. I mean, we are changing systems. We are strengthening systems and policies, but we are changing actual lives. And you can see them because you can talk with these adolescents 3 years ago and now, and they are self-confident, they are aware of their rights, they are very active in their citizenship, and they are participating, and they are aware on gender inequalities. And this is very, very nice to see and to hear. No? I wish you could come with me to see them because they are, I mean, they are fantastic. No? We are ready to go further and to engage more adolescents, but we are very proud of them because they have changed. They have changed a lot, and they are much more empowered. Especially girls, no? Especially girls. You see a shift, a very strong shift, and they are empowered, and they will ask for their rights, and they will lead the meetings. So we are very proud of them. That's true.
Thanks, Anna. How wonderful to hear and be able to see that tangible difference over the course of a few years and witness that firsthand. That's really wonderful. Thanks for sharing that example. This next question we have from Liz Witham. Sorry if I said your name incorrectly. What specific programs have led to this increase in confidence among the young women?
So I think start talking about girls and boys' interests and needs openly in schools and training teachers, male and female teachers, to address all topics for adolescents is the first step. Because sometimes adolescents and adolescent girls feel that their issues, their things, their dreams, they are not important. So to have an environment where they are able to express their visions, their problems, and their dreams, I think is the first step. And to have this in the school setting, it's wonderful because it's where they meet every day, where they have the socialization moment. No, I mean, it's very important for them. So I think for them that knowing that the school is a protective environment, an environment who cares about adolescents' visions and problems, I think is the first step. Also, we have been very cautious to work sometimes separately with girls, to specifically work with them leadership skills and empowerment, and with different intervention, no? Public speech, self-esteem. So they have, I think we have enlarged their potential, and they have been invited to be more proactive at the school, but not only in the school, but also in the community. So in a very brief period of time, they have seen themselves and perceived themselves as someone important in the community with something to say, with views, and supported with a group of adults of reference as teachers, headmasters, families, and health and social workers, who are giving this space to adolescents to talk and to be more visible in the community. And I think that's something great, specific for girls.
Thanks, Anna. I think we have time for maybe one or two more questions. This next question is, how is violence specifically addressed at school? And then I'll ask this next one too, to you, Anna, so you can think about it. What gives you hope?
Well, violence in school, I mean, is one of the big problems in Peru. Schools are still places where violence occurs. So we have been working for the last, I would say, 5 years in setting up a national program to prevent and reduce violence at the school settings with the Ministry of Education. And we have been set up a whole program of monitoring and reporting where students anonymously can go and put a claim online, online or physically. And we have been also giving technical assistance to the Ministry of Education to adapt the regulations to remove teachers and give administrative sanctions and administrative and or judicial measures when teachers have been involved in violence. So this was not happening before. It's very, I mean, you cannot believe it, but it was very difficult to remove a teacher even if he had a suspicion of being violent. And now this has changed because of Unicef support to Ministry of Education, and there are strict measures of administrative disciplinary measures to remove teachers. But besides of detecting violence, which is one of the key things, we also want to work in the curriculum and the training of teachers, to make them also be aware of other colleagues who could be using violence, and also how violence models are not appropriate to teach in the school. So it's a cultural shift. It's not so easy to change because cultural changes take their time, but we see very committed, and this is where my optimism rise. We have very committed headmasters, teachers, and in the community who are challenging this thing of that violence could happen in school. Violence is not culturally accepted in the school. It's still happening, but at least it's not accepted as something that it could be happening, that maybe some years ago that something was very accepted. So we see that the cultural norms are changing, and the community is aware that schools should not be using violence at any forms. And also to empower adolescents is very powerful because they are the ones also raising for the rights, and they are not afraid to point when something, when they are in a violent situation, and they go for help. So this is a change that I think is very important, but there's still a long way to go. I think Peru still is a very violent society, and violence against girls and boys is still very into the cultural norms, specifically within the family. But I would say that school social acceptance of violence at school has diminished a lot, which is a very good starting point.
Great, and I think there's two more I think they can be quick questions. The first one is a good follow-up to this question that was just asked. Are there law enforcement to offer or to those offenders who act to domestic violence? And the last one I think that you can wrap us all up with is, what gives you hope in the work that you do every day?
Okay, so yes, there are laws to prosecute violent situations. The issue is to detect, because sometimes girls, boys, and even women, they don't have the confidence that the state will be addressing appropriately the issue of violence. No, so the systems are there, and we are making a lot of noise also with campaigns with other UN agencies, but we still have to make sure that every reported cases is going to be appropriately addressed, because otherwise we are not improving the confidence of the population. No, so violence against women is something in the political agenda. Is one of the priorities of the government, but I would say that detection of violence is still a very big bottleneck. So this is why health services and education services have to be trained, because they are the ones who are mostly the first entrance for many of the population. Children, adolescents, and women are users of health services and education services. So it's very, I think it's very important to train these workers so they can detect and they can refer, and then that person can be more supported. No? And what gives me optimism every day? Well, to see the faces of the children and adolescents we help and we work with, this is the most shot of optimism that you can get, and to see also the results that we have and the partners like you, that committed people around the world that maybe have never been in Peru, but they are committed with their hearts and minds to change the situation of many children and adolescents. Also my great team, some of them are here now. I have Michelle and Gabby here, we have more people. And the mandate that we have, I mean, I think Unicef has the most powerful and beautiful mandate of any agency. And we have the support of many people like you who believe in empowerment of adolescent girls, and that with the small efforts, we can do great changes. This is my shot of optimism.
Thank you so much, Ana. I think that's a wonderful note to close our Q&A on. So I think that's going to give us all hope moving forward too. So thank you. I just want to thank everyone so much again for taking the time to be with us today. I know how meaningful and important it is for you to forge a connection with the country where the programs you're supporting are taking place, and with the service providers who are working hard on those programs, and most importantly with the girls themselves. And while our current pandemic circumstances are preventing us from being able to do that in person this biennium, we hope that today has gone a little bit of the way in bridging a bit of that geographic distance with Peru, and a lot of the way in bridging that connection with the communities themselves. I know that for me personally, I'm going to leave today in awe of the girls, first and foremost, of Peru, who are working so hard on their own behalf, of the healthcare workers, the teachers, the social workers, even the boy allies who are continuing to drive forward despite the circumstances of the pandemic to ensure that adolescent girls have safe spaces and environments that are strong enough for them to be able to access care. And it really takes courage. And I think that's, one of the key messages that we heard from Ana today, is how courageous these adolescents are and how inspiring their courage is. If it weren't for our partners like Zonta, Unicef wouldn't be able to do any of this work, wouldn't be able to continue its work in these challenging times, and wouldn't be able to scale up its response, which of course is the goal that we all have. So thank you so much to all of you for the continued support and for what you're going to continue to provide over the next half of this biennium. And we hope that you're all going to leave here today with a renewed spirit to continue our shared mission to uplift adolescent girls in Peru and to bring this message that you heard today to others around the world through Zonta and through your communities. So with some closing thank yous again to UNICEF Peru, and particularly to UNICEF Peru representative Ana Mendoza and her whole team. Thank you to President Sharon and Megan Radovich again for collaborating with us to put this visit together. And thank you most importantly to the members of Zonta International for your commitment and your dedication as we continue to navigate this world in these big times of uncertainty. But we also know that no matter what happens, it's clear that there's a desire for us both to ensure equity and access for girls. So over to Sharon for some final words.
Thank you, Rachel. Before we officially end today's visit to Peru, I would like to extend a very special, heartfelt thank you to Ana and her UNICEF colleagues in Peru for taking the time to being with us today and for gathering photos and videos to share the realities of life for adolescent girls in Peru. We truly feel that hope for that generation of girls, and that really came through, and very special to know that we are making a difference. When I began the process of identifying potential programs for Zonta International support almost 3 years ago, I wanted to look at underfunded or overlooked areas of the world as possible opportunities for new Zonta projects. The work that UNICEF was doing in Peru really stood out to me because it combined education, which I believe is vitally important for all children, and the health and protection services specifically for adolescent girls to help them understand their rights and develop the self-confidence and autonomy to take control of their lives and realize their full potential. Today, I am even more convinced of the importance of this project, and I'm very grateful that Zonta members across the world agreed to support this life-changing work for adolescent girls. It's wonderful to see the progress that has already been made, despite the ongoing challenges of COVID-19. And I look forward to hearing about UNICEF's continued success going forward. I would also like to take this opportunity to thank our members for their generous support of this project. I hope today's visit has demonstrated how much your contributions are needed and how far they are going to make a difference for those girls in Peru. Thank you again to the UNICEF team in Peru and to our UNICEF USA colleagues in New York for helping to arrange this wonderful visit. We are grateful for this continued partnership, and I am looking forward to the next 9 months and keeping in contact with our work in Peru. It is so special. Thank you.
Thank you, Sharon. We are very, very happy to have this partnership with you, and I hope you can come to see us, to visit us next year, hopefully.
I hope so too. Thank you.
All of you, the 22 who are here, I want you to come to Peru. We will try.
Thank you.
Thank you all.